Wash hands. Three things you need: socks, pants, and a shirt. Make sure when you're doing this skill, you ask the patient what they like to wear, their preference, and their clothing. Remember, they're wearing street clothes, their own clothes. So, what would you like to wear? Da 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 da. Okay. So, Miss Lucy, what would you like to wear? I got some red and white socks, and then I got some regular white socks.
That's smart.
I guess I'll just put you on. I'll put you on this shirt or this blue shirt. So usually when you're dressing a patient, you're going to start from the bottom and work your way up. Alright? Don't worry about a barrier. The clothes are barriers. Okay? So I'll start from the bottom. And you just put the socks on. So mind you, I'm keeping the patient covered up here, and I'll work my way up when I get that far. Okay? So still keep your patient covered at all times, okay? Let's put socks on. I mean, y'all can dress yourself, y'all can dress the dress. Look, it's not that hard. Okay? Alright, so next I'll do the pants. And there's no weak side for pants. I mean, you know, there's no weak side for the legs. Don't worry about that. Just put the clothes on, or put the pants on. Back down here, still I'm keeping her covered up, and I'll just come up here. Oops, correction. Call light fill. Miss Lucy, can you lift up? Thank you. You can just have the patient lift up. All right, covered up still. So Miss Lucy, what side is your weak side? Oh, my weak side is the left side. All right. So whenever you see a patient that says right side, left side, weak side, just put the shirt on that side. Because remember, you're undressing strong to weak, and then dress weak to strong. Alright? So, put that over there. Let me just get your gown undone up here. Slide it off. Still keeping the patient covered while you get them dressed. Okay? And then I'll come over here. The other side. Whenever you putting stuff, roll it away from you. Okay? So, like I said, dress weak to strong. So, we'll kind of cover up a little, and just slide her hand around. Gosh, you know, got this shirt, Miss Lucy, because I think last time I got this shirt, it didn't really do too good on me, but we'll try it. Make sure you're asking your patients, how do you like your buttons? Would you like your buttons closed on your wrist and your collar and stuff like that, okay? So, Miss Lucy, can you lift up? I'll just put this on this side. Just have your patient lift up. Alright, make sure the shirt on the other side, you know, this side is straightened up a little, so all you got to do is just button up when you get to the other side, okay? So that's dress weak. Back to the strong side. Now remember, the strong side, you can move in whatever direction. It's just the weak side is just like that, okay? So the strong side, I can pull her arm, go like this, and she can just lift her arm up and slide her hand right on through. You can't do that with the weak arm, okay? So just know the difference. All right, Miss Lucy, let me pull your shirt down in the back, and I'll fix your buttons on your arm here. Shirt button all the way up? Yes. All right. So she's going to get her shirt buttoned up. And make sure you ask that they look for that. Fix the collar and And make sure, you know, this is all about presentation. Make sure your patient looks good while you're dressing them. Well, I'm gonna be here all day buttoning your shirt. Okay. She likes all the buttons done. And even though she's dressed, I still have to keep her covered up until she get ready to go. Patient needs to still keep their dignity, even though they're in the bed, you still put a cover on. Alright? So I did all the buttons. Fix a sheet. Alright. So do you need anything else, Miss Lucy? I'll go check on your breakfast and make sure you get breakfast before you go on your appointment. The gown will be laundry. If you're practicing, don't throw it in there. It's dry. I'll just make sure her sheets. Okay. Alright. See how everything looks? She's still dressed. Everything still looks nice and wrinkle free. I'll give you back your call out, okay?